So I'm here with Dr. Andy Knox, and if you could just briefly outline your role, that would be brilliant.
Sure. I actually currently have 3 roles. So I'm a GP, so I'm a family doctor in Ashtree's surgery in Carnforth, which is a practice which has about 27,000 patients in the north part of Lancaster district. And then I'm also a commissioner. That means I am someone who helps work out where the money needs to be spent within the health service around Morecambe Bay. And I'm also the Director of Population Health for the Morecambe Bay Health System. So what's happening in healthcare at the moment is we're trying to amalgamate and join together all the different bits of the health service that have been working in different kind of silos to each other and join them all up. And I'm the Director of Population Health, and so one of the things I really look at is health inequality and how we can improve the health of the whole population together.
Oh, nice. And you're also really interested in mental health and the wellbeing side of things.
That's
as
right,
well.
Big time. Yeah, it's a huge part of my role is making sure that we don't just think about health in physical terms, but in mental health terms as well. And I'm particularly interested in working with young people around the issue of mental health and how we can improve mental health and face up to some of the mental health crisis that we've got currently here in the UK.
And obviously we're here today with Escape2Make, and I was just wondering, from a mental health point of view, how do you think charities like Escape2Make can have a positive impact on lives of teenagers in the community, given the right funding and resources?
It's a great question. So I'm a big fan of Escape2Make, and I think it's an amazing charity. I think that there are 2 things in particular that are really, really important that it does for improving the mental health of young people. Firstly, it breaks down isolation. So it gets people off the screens and off that kind of whole slightly isolated part of the world, even though that can be through social media. The ability to just put some of that down, stop that interfering with the brainwaves, and then just to connect with other people. So those 2 things together, kind of less social media, less of some of the pressure that brings, and then the space to come and connect as people and build those relationships and friendships, breaking down isolation and loneliness, and kind of able to connect as human beings is massively important.
And do you think that teenagers today face the same challenges that you did when you were a teenager in terms of things to do around in the community?
I think it's a great question. I think that there are, I think yes and no is the answer. I don't think it's necessarily an either or. I think that all of us growing up face the same challenges as human beings. It's about who we're becoming as people. And that's a real wrestle. And that's really hard for all of us, because it's about who you're becoming as a human being and all the wrestles that go on and the changes in your body and your mind and the makeup of your mind. That's a properly difficult part of life to go through. So all of us face that, and all of us have to go on that journey. But I think for your generation, there are some things that you're facing that we didn't have to face. I think that there are much bigger issues. We've lived through a huge amount of austerity. We've had the biggest and longest cuts to our public services in the history of the welfare state. And that has had an absolutely profound impact on the kind of services that are available for young people in terms of drawing people together. I think it's put huge pressure on you guys and your generation in terms of just being able to have things that are naturally available. So we've seen a huge cut in youth clubs and children's centres and all those kind of things. And that tears communities apart and can have a really, really negative impact. But I also think that there's some stuff around the big issues that we're facing up to around stuff like climate change, the underlying narrative that is really kind of worrying. Do you know what I mean? And that anxiety, the angst underneath all the stuff that goes on every day anyway is huge. And then, to be honest, the mobile phone only ever came out when I was about 18. So, like, in the way that we would be using it now. And the way that that's grown and the pressure of social media is something that I never had to think or contend about. And just things being so instant and in your face immediately, that was never even a consideration for me. So my weekends were spent out on my bike with my mates, hanging out, playing lots of sport, doing all that kind of stuff. Whereas now, I think a lot of service provision's gone away, and also much more technology is in our hands. Now there's a great opportunity there, and I think it can be amazing when technology is used well, but I think it can also be really, really damaging for mental health when it's not.
Yeah. And so East-Wem isn't strictly a mental health charity,
No.
but how do you think early intervention is in terms of importance compared to provision for those with more complex mental health needs?
Yeah. So I think it's both and I think there's a little bit of a dangerous rhetoric, especially in the government at the moment, that we want to move everything upstream towards prevention, and we do. We absolutely do. So one of my favourite quotes is by a guy from South Africa called Archbishop Desmond Tutu, and he says there comes a point in life where you've got to stop pulling people out of the river and wander upstream to find out why they're falling in the first place. So I really, really passionately hope that here in the UK and all over the world actually, that we can understand what it is that's causing young people's mental health issues in the first place, and develop a kind of much kinder, compassionate society. That means that actually we can embrace the issues around mental health and prevent them from happening in the first place. But we also have a crisis now, and it's not okay that the current level of provision is so poor that when people are in crisis that we're not able to wrap around some of the care and services that we need to and make sure that people get the help they need. So I think we need both. I think we absolutely have to understand and prevent mental health issues occurring in the first place by really building up self-esteem, by doing huge amounts of work around what's going on with the curriculum in schools, by a whole load of things around how we connect and understanding the things that damage mental health and prevent that from happening, and put more healthy stuff into our lives together in communities. But I also think that we can't just let people suffer, and people who are in crisis need the help now. And even if we prevent lots more mental health, there's still going to be crisis further down the road for some people. Some people are going to struggle with different mental health disorders and different mental health conditions at different points. And actually just to make sure that we have the provision at the point where people need it is really, really important. And right now, that's something that we're not doing as well as we could.
And obviously it's inevitable that everybody will struggle at some point. Everybody has mental health just as they have physical health as well. But this area is one of the few areas where the CAMHS intake only ends at 16 and doesn't go all the way up to 18. And for that age group, 16 to 18, there's no real provision for mental health other than A&E and crisis teams. So what can we do about that?
So that is changing. So there's been a big piece of work just done by some of my friends in commissioning who work around mental health and young people's provision. And we are spending a lot of money over the next couple of years to really try and crack that nut and get that sorted. It's not okay. It's not been okay for a long time, but it's something that we're really, really trying to work on and change right now, working with young people and their families. And there's been actually some really great work done across Lancashire and South Cumbria in the last few months, particularly bringing together people who really need and use our services to work out how we close that gap and get that right.
And in theory, if you were Prime Minister, what would you do for teenagers?
Let me say, I think our political system is really broken, and I think it needs a complete overhaul, especially for young people. And one of the things that I think government needs to do far better than it does is listen. So first of all, I would genuinely, and I try and do this as a leader now, is go out and listen to people where they are. So rather than have something that comes to London and just it's a select group of people that come to me where I am, I was really troubled that the Chancellor recently said, in response to the UN rapporteur wrote this amazing piece about poverty in the UK and the effects of austerity. And the Chancellor responded saying, "I don't see poverty." So there's an old song that I knew when I was a teenager that says, "Let me take you by the hand and lead you through the streets of London." And I feel like politicians need to get out into Sunderland, Birmingham, Manchester, Lancaster, Morecambe, Brighton, Hastings, Scunthorpe, and actually be with young people where they are, really hear, really feel the pain of what young people are actually experiencing and living through, and have the humility to go, I don't know all the answers. Some of this is really complex. How might we together face the future and build the kind of future that you want? And that is what I would do as Prime Minister, because I believe in humility, and I believe in listening, and I believe in being together with people rather than doing things to people.
And if you reverse that, if you were a teenager today in Lancaster, what would you want?
What would I want? Gosh, I don't know. I know that I would want someone to tell me that exams are not the be-all and end-all of everything. I'd want to know that my worth does not come through how I perform in life. I would want to know that there were places that my opinions and my dreams mattered. I'd want to know that people were taking climate change really seriously. I'd want to know that there were spaces that were safe for me to go and connect, and where I was able to just hang out with my friends without people being suspicious of me. And I'd want the older generation to turn their heart towards me and make a space for me to be and to learn and to grow and to fail and to become who I'm becoming without being judged.
So do you think teenagers today, right now, in this current climate, can do anything in their community to improve their own mental well-being, as well as the mental well-being of others and just their communities in general?
Yes, I do. And I think there's some really good research that shows us some of the things that help. So there is something called the 5 Ways to Wellbeing, which there's some great stuff around this actually. So one of them, and it's not necessarily that popular with teenagers, is to be active. Being active actually massively improves our mental health because it improves the release of what's called endorphins in our bloodstream, which are happy hormones and actually lift our mood. So being active, eating healthy. Oh my gosh, if I could try and encourage teenagers to not eat too much junk food and stop eating so much sugar, which just feeds, unfortunately, some of the negative stuff that happens in our bodies, and like really embrace super healthy food that's really tasty. And that's one of the things I'm really excited Escape2Make are looking at, is actually how to cook well, how to work with fresh ingredients, how to experience different flavors. That would be really big. I think there's something about learning to give. So there's something about volunteering and getting stuck in and serving your community that really improves mental health. Connection, like connecting across generations, spending time with people who aren't exactly like you. One of the things that I wish someone had said to me when I was a teenager is go spend some time with people who are profoundly different to you. Because I think it's when we encounter difference, we encounter people who are others, that some of our own attitudes are broken down, some of the ways we think we see the world are broken down, and we begin to see the world differently and change our perspectives. And I think if we could connect people across difference more, we probably wouldn't have some of the issues we're facing around division and hate in our society. So I would say connect is really important. Keep learning, keep really fascinated. And keep pushing yourself to go and find new skills, new things to learn about. Keep interested in life, and then be mindful. So take some time out to be grateful for there's so much to be grateful for. I think it's really easy to find the negative, but actually if you find something to be grateful for in life, and like every day we do this thing around our table with our kids where we say 3 things that you're grateful for today. Let's just have an attitude that actually begins to shift from the negative to the positive. There's so much goodness in the world. So let's find some of that to focus on. And then kind of within that, not just being grateful, but within taking notice and being mindful, it's about learning to switch off. So we have a no screens on a Sunday rule in our home. So everything, my screens, and I'm the worst for it, all my screens, all my emails, everything gets switched off. And we have time together. And actually having a break from social media for a full day once a week, and actually limiting your time, particularly in the couple of hours before bed, which massively improves your sleep pattern as well, which hugely improves your mental health. Those things are really important. So those would kind of be some of the stuff that I would love to see teenagers embrace and us work together in communities on. Yeah.
And finally, if we come full circle, how would you describe Escape2Make in 4 words?
Innovative, creative, kind, and connective. I'm quite pleased with those.
Well, thank you.
Yeah, you're welcome. No problem.